Welcome to my channel once again. Today we are going to look at hallucinations. Definition of hallucination. So a hallucination is a false sensory perception occurring in the absence of an external stimuli. So what you need to know over here is that hallucination, one, is a false sensory perception, and two, it occurs in the absence of an external stimuli. Key focus for an exam is to know that with hallucination there is no real stimuli, and this serves as a differentiation between both hallucination and illusion. An illusion is just misinterpretation of an object. Types of hallucinations. Our first one is auditory hallucination, which is the most common. So you note it for exam, which they could ask which of the following type of hallucination is the most common, and that's auditory hallucinations. So this occurs when someone or a patient or a client hears sounds or voices that are not present. So the sounds and voices are heard by the patient but cannot be heard by anyone around that particular individual. That is auditory hallucination. So example, when the patient hears someone mentioning his or her name, but technically no one is doing that. Then the second one being command hallucination, which is key over here. So this hallucination brings up a voice saying kill yourself, jump over the roof. So in management of patients with hallucination, especially auditory hallucination, you monitor for command hallucination because that is very dangerous and suicidal. Our second type of hallucination will be visual hallucination, which is vision. So this type of hallucination occurs when a patient actually see things that are not present. So meaning seeing things around him or her that no one else can see. Example, the person complains seeing dead relatives around, but everyone around that area can't see what this individual is actually visualizing. Then we have seen animals or shadows. The person sees animals and shadows in the room or wherever he or she is placed, and then technically no one around there can see these images. We have tactile or haptic hallucination. So this is more of on the skin. So feeling sensation without stimulus. So the individual feeling insects crawling on the skin. I need to note that word formication. So formication refers to the tactile hallucination where the individual feel like there's an insect crawling on the skin. So note that formication for an examination purposes. Then sensation of being touched. So you feel like someone is touching you, but actually there is no visible external stimulus showing that that is true. So that's tactile hallucination. Then we have olfactory hallucination, olfactory nerve as a focus over there, which helps in what? Smelling. So here the individual smells odor that are not present. So the individual is smelling odors that no one else around is sensing that at a point in time. So example, smelling smoke or rotten food without a source. So there is nothing burning around. There is no food around that actually rotten, but the individual sense or smells that kind of odor. It's an indication of olfactory hallucination. Gustatory hallucination. So here defined as experiencing taste without any corresponding stimulus. So there is no stimulus indicating that that taste should be present. So the patient or the individual feels persistent bitterness or metallic taste in the mouth without any external stimulus. Can be classified as an example of gustatory hallucination. We have kinesthetic or somatic hallucination. So here there is false perception of the body movement or internal sensation. Example being feeling organs moving inside the body or feeling that your brain is shaking. So here in this state there is perception that the internal organs are moving or they are shrinking or there's something moving these organs, or the body is moved without any stimulation, external stimulation. So this can be classified as kinesthetic or somatic hallucination. So here is a diagram presentation of or a graphic presentation of the types of hallucination, but my main focus is on the last two, which is the hypnopompic and then hypnagogic. These are the two we are going to look at. So with the hypnopompic, it occurs upon waking up, and then with the hypnagogic occurs while falling asleep. Alright, so let's continue with the management. So the first thing to do is your assessment to determine the type of hallucination and ensure safety in terms of common hallucination which are be suicidal. Then acknowledge but do not validate. So you acknowledge what the patient sees, hear or taste, but do not validate it in order to reorient the patient back into reality. So three, you can reduce environmental stimuli. Example, by providing a quiet environment. Then you can engage the patient in diversional therapy as well to shift the patient concentration from the hallucinations phenomenon. Encourage reality orientation, which we discussed earlier, and then you can administer prescribed antipsychotic medication for its therapeutic reasons. Then you try monitor for common hallucination, which we discussed as the first point over there. Then provide emotional support where necessary to reduce anxiety and fear. So let's pick up with some few MCQs. So we have a patient hears voices giving commands. So that's command hallucination. What is the priority action? So we have ignore patient, argue with patient, ensure safety, give food. So you actually assess and then ensure safety as the answer. Then two, the best response to hallucinating patient is we have A, that is real. B, I do not hear it, but I understand you do. C, stop talking nonsense. D, ignore. So the answer is B, where you actually don't validate but you acknowledge. Three, the most common hallucination is we have visual, auditory, tactile, olfactory. So the answer is auditory, which we discussed during the presentation. Alright, alright, we are done for the day. Thank you for your time. Like, share, comment, and subscribe.